Health and Human Services Secretary Robert F. Kennedy Jr. will implement placebo testing requirements for all new vaccines. It's a major shift from past practices. For more on this, let's bring in former acting FDA commissioner and former assistant secretary for health, Dr. Brett Giroir. Doctor, thanks for joining us this afternoon. What do you make of these new testing requirements? What will it mean?
Well, thank you for having me on. And the concept of a placebo-controlled trial is the standard of care in modern medicine in the United States and Europe and most places around the world. So this is no surprise. I think there are three exceptions to this, which I'm sure the FDA and Dr. Makary will accept. And that is, number one, if there's a good treatment already. In other words, you don't give a placebo if there's a reasonable treatment. We would never not immunize people against polio and let them get polio. We would compare a new vaccine to the old vaccine. The second exception would be in the rare circumstances where there might be, let's say, 100% fatal disease in children, and no one would want their child to volunteer to be the placebo group. And the third is the rare exception like the flu vaccine. Because we've done it for 80 years, and the flu vaccine only changes minimally, we don't need placebo controls every year. So I think what he's outlining, it really is the standard of care, and he does not mean to negate those rare exceptions, for sure. I spoke to Dr. Makary yesterday, and he assured me that the flu vaccine, because we've had 80 years of coverage, is not going to have to undergo a placebo-controlled trial every year.
How about COVID? I mean, it is a flu, but we haven't had it around that long.
Yeah, COVID is one of those things that I actually 100% support what Dr. Makary said, in that where we are with COVID today is far different where we were when we developed the COVID vaccines during Operation Warp Speed. No one was immune at that time. They didn't have very little natural immunity. There was no vaccine immunity. And we really haven't studied the boosters in a placebo-controlled trial way. We did the original vaccine, that was placebo-controlled, but everything has changed. So what Dr. Makary has said is that he's going to look at every individual application, and it is possible that he might require placebo-controlled trials for COVID. And I would support that because the world is different now. We don't have good data in 20-year-old young men who are immune. They're not going to get hurt by the natural infection, but they could have harm by the vaccine. So I think he's going to look at that, and I would support that. So this is not radical. This is not a radical change. This is just good science and medicine that they're proposing.
Secretary Kennedy has expressed some skepticism about the technology that went into the COVID vaccination, mRNA. What is that, and is it safe?
So mRNA vaccines have one tremendous advantage, and that is they could be made relatively quickly and they could be manufactured relatively quickly. They're a new form of vaccine, but right now there is no substitute them for rapidity. In other words, if we had a new pandemic that arose, tomorrow, let's say a new pandemic influenza strain, it would take 7 or 8 or 9 months to change those strains and make enough vaccine, whereas mRNA could do that in about half the time. I've reviewed all the data on mRNA vaccines. There are side effects to mRNA vaccines for COVID, but they seem to be a class. In other words, they're not limited to mRNA vaccines. They are common among vaccines in that group. For example, myocarditis, which was common in the viral vaccine. So in general, mRNA vaccines appear to be safe and effective. They are a new vaccine, so we need to continue to study them. But their big advantage is if we're pressed for time, they are the most rapid response that we can have, and that's what you saw in COVID.
The secretary also talked about parent involvement when it comes to the question of whether their children should be vaccinated. Here's what he had to say.
We live in a democracy, and part of the responsibility of being a parent is to do your own research. You research the baby stroller, you research the foods that they're getting, and you need to research the medicines that they're taking as well.
Do you agree with that? And don't you think that sort of opens the door for people to be getting research in places that really aren't credible?
Well, I'm a pediatric ICU physician, so I know this very well, and I do believe that parents need to be educated. I want to empower parents. I believe in parental control. That being said, I think the best research a parent can do is to talk to their pediatrician, to talk to their family practitioner who's been trained for 20 years, their pharmacist, their pediatric nurse practitioner. It is really impossible for most parents to delve through 20 years of scientific literature and come up with some type of conclusion. And you're right, they're going to be subject to the charlatans who are on the web saying all kinds of bad side effects that don't really occur. So look at the authorities and always do your own research. But people like your pediatrician, like your healthcare providers, like some of the groups, the advisory committees on the CDC, they are really acting in your child's best interest. What you shouldn't do is listen to people who have no scientific or medical training, who have a history degree and maybe went to law school and made their living suing people. You should listen to medical professionals. Always do your own research, but count on the people you trust with your child's life every single day. That's my best advice.
What does it say about public health in general? It seemed like a lot of credibility was lost during the pandemic. Do you think it's starting to get its foothold back? And what's the best way that public health can regain the trust of the public?
It's a complex issue, but I think many during COVID said things like they were 100% true when we didn't have all the data to support them. And we all know what that is, right? Don't wear a mask, wear a mask, don't wear a mask, you have to wear a mask. And everyone was 100% sure. I don't think I was one of those people. The absolute certainty, particularly in 2021 and 2022, take the vaccine and you can't get COVID. None of that was true. So I think the best thing that public health practitioners can do, and what I think most practitioners, when they're talking to a mom or to a patient, is to be humble, to be honest with people, to tell them what you know and to tell them what you don't know. Don't try to manipulate them. Give people the facts and let them make the best decisions. I think the public health system is moving in the right direction now. I do think RFK's move for more transparency and openness is very, very important. I think removing any conflict is very, very important. I 100% support him on these aspects. I am much more positive about vaccines than he is, but I certainly support him 100% on his nutritional policies, on his transparency and reduction in conflicts of interest. That will all help with trust.
All right. Dr. Brett Giroir, thanks so much for joining us.
You're welcome.
Hey, it's Will Cain. Click here to subscribe to the Fox News channel on YouTube. It's the best way to get our latest interviews and highlights. And click to subscribe to the Will Cain podcast for full episodes right now.